I like this topic because it's kind of unclear for how people going through Achilles tendon issues, how to address it and what form of it. Hopefully we can make that clear and have a better understanding of what's going on. The Achilles tendon is the strongest tendon in the body. As you can imagine, it has so many forces that transmit through it when we're running and walking. And I'll show another picture in a moment, but the Achilles tendon is attached by the gastrocnemius muscle, and deeper to that is the soleus muscle, and the tendon connects all the way down on called the calcaneus or the heel bone. So as I was saying, it can stand up to potentially 1,100 pounds of force. And there's a lot of different roles for this tendon and the muscles that it connects with, but a large part is to help to control the leg from collapsing. Obvious functions, of course, to stand up on your tippy toes and stuff like that. So we did patellofemoral pain first, and now we're on Achilles tendon pain, which is about 9 to 10% of runners of area of vulnerability or injury. To get a little more deeper in the Achilles tendon, there's something called the watershed zone. And this is an area of great vulnerability on the tendon itself. Now we have to think of blood flow as nutrients for the tissue. So if you have more blood flow, the healing is so much better. So for example, muscles have a lot of blood flow, so they tend to heal pretty dang quick. Tendons, on the other hand, have a little bit less blood flow to the area. Specifically, in the middle zone, called the watershed zone, is the least amount of blood to that area. So as a result, there is increased risk of injury to this area. Research shows it's about 55 to 65% of the time, where the other part is where inserts down into the calcaneus is another area of vulnerability. And I just want to show this kind of picture. It's a little bit graphic or maybe extreme, but just get the idea that the tears could look kind of like this, just little breaks in the fiber along the Achilles tendon. To reiterate a point, on the y-axis or the vertical axis is the amount of loading, response to loading for the blood supply, so the amount of blood supply you have. And on the x-axis or the bottom is healing time. So as I said before, the muscle has a lot of blood supply, so the healing time is pretty dang quick. And then you have bone, and then you get to tendon a little bit later on for healing time. And there are a few risk factors for Achilles tendon issues, but one of the biggest risk factors I see as a clinician is just overload, especially this time of year for a lot of resolutions kicking in. People tend to do too much too fast. So this graph kind of depicts a zone of high risk of injury. The vertical axis is injury risk, and the bottom axis is just training load. So your injury risk increases when you have low training load. And that makes sense because your tissues aren't strong enough to take on the forces you might impart upon them. If you load a lot, the tissues can also just be overloaded, even if you train really well. But if you really overload it too much, it can also cause risk of injury. So when we train, we want to train kind of the middle zone, where you put some load on it, but it's not too overwhelming. And then at times you even stress a little bit more, and then it recovers and rebuilds and go along that way. So the question is Achilles tendonitis versus tendinosis. On tendonitis, we typically think of a very acute injury. Tendonitis usually presents with more higher pain, and you get this redness and swelling in the area. And I'll show you a picture in a moment. And it tends to be worse with activity. So the more running you do on it, it gets worse and worse and worse until you can't run anymore. And with tendonitis, it may improve with some temporary rest. Tendonosis is a little different. Tendinosis is essentially where there was an injury and the tissue never really fully healed. How this presents is typically people actually have some stiffness in the morning, and then when they run, the pain actually gets better as they run, as opposed to tendonitis where it gets worse. And then there's a little caveat to that. It might get worse towards the end of running. But usually there's no redness or swelling in the tendinosis. So it's not really a big inflammatory process going on. And resting does not seem to help it because the tissue is weakened and it's just kind of in a stagnant state of weakness. But what's interesting to know about tendinosis, it's the characteristic of a thickened tendon. So where a tendonitis is more swelling, puffy, and red, tendinosis is more thickened. And that's a result of the body's response to try to heal the tissue, called collagen, is a little more disorganized. So it's all clumpy. And this is kind of what it looks like. On the left side is a typical tendonitis where you get some redness and swelling. And on the right side, they did a nice job here in marker. We can see a kind of a bulge in the middle of the tendon. And this would be mid-portion or the watershed zone of the Achilles tendon. So two types of Achilles issues. One's more inflammatory, the other's more just disorganized, weaker tissue overall. So we'll start with the tendonitis first. It's a little more straightforward for treatment. It's just let it chill out. Active rest, ice it down, listen to your pain. If the pain increases too much too fast, just back off. Generally speaking, I tell people to you can do some biking or very light work until the pain reduces significantly, and then we can reload it. Other things may help is taping just to help unload the tendon as well, which we have on our website. Now a little more in depth of tendinosis. So I love to start with this background of Dr. Alfredsson. He's a Swedish doctor, and he actually had an Achilles tendon issue. And at the time, they didn't really know what to do in regards to conservative care. So he was a runner. He's like, hey, I want this to get treated. And he went to his peers and colleagues and saying, hey, can you just do surgery on my tendon? And they're like, hey, I don't do surgery unless it's really broken. So he was kind of pissed off. So he went to the gym. He's like, you know what? I'm going to try to break it. So what he did was he actually loaded the tendon. So he was overloading it, hoping that it would cause some kind of disruption for him to get surgery. But what he noticed was the tendon actually started to heal and feel better. And this kind of aha moment clicked for him. Is like, wow, my tendon is actually responding to the load I placed upon it. So Dr. Alfredsson is one of the pioneers in tendinopathy or tendinosis of how to treat it. Essentially, for tendonitis, you kind of have to let it chill out. For tendinosis, you have to load it. You have to change the tissue to respond to greater loads. So in fact, we encourage you to actually work out into some discomfort for tendinosis. So for patients that come in for Achilles tendinosis, I say, hey, we can push into pain about less than 3 out of 10. I don't want a lot of pain afterwards or the next day, but I want you to feel like something has been done. And I'll show you what the video looks like, but they've done a lot of studies for eccentric loading over concentric loading. So eccentric is a lengthening, but it's a very controlled lengthening of the tissue. And for some reason, that helps stimulate the collagen tissue, which is called type 1 collagen, to stimulate the collagen synthesis to get more stronger in the tendon. So it's not about fast, it's about nice controlled loading, and I'll show you a video in a second. The question we have is, does it change the actual morphology of the tissue? Does it look healthier? So here's a video of what eccentric loading looks like. There's no sound to it, so it's just me here. I come up on 2 feet, and then I load the right slowly, eccentrically, up and down. I might be going a second too fast, but usually about 3 count, going down. So that's loading the tendon, and I would do that for my Achilles tendinopathy or tendinosis patients, usually 3 sets of 12, most days of the week. I do want to mention a professor I worked with at USC, Dr. Cornelia Kulig. Though we didn't talk about the Achilles tendon, we talked about postiotibial tendon, which is right by the foot, and we talked about tendinosis for that tendon as well. So I'm kind of extrapolating some of the findings we had here on the Achilles tendon. So we did an eccentric, same principle as the Achilles eccentric program for the postiotib tendon. And long story short, people that had tendinopathy or tendinosis responded very well for the eccentric load compared to the concentric load. And I want to also say concentric load also helps, just not as much as eccentric loading the tendon. The reason why I bring this up is we actually did ultrasound of the tendon. So the question is, does the tendon actually change in morphology? Does it look like a healthier tendon? The study we did, took people through a 12-week program and imaged them in the ultrasound every, I believe it was 6 weeks. And we found that we didn't see a big change in tendon morphology. The symptoms got better, but the tissue morphology, we couldn't say with the significance that, hey, the tissue changed. So if they have to ask the question like, hey, when can I begin running? Or what's a really kind of a good measure of my Achilles health? Kind of simple measure is are you able to do 25 quality single leg heel raises on a step? If you can take that load, you're probably in pretty good shape for your Achilles tendon. So kind of the gist, the key points of this lecture is a tendonitis is usually acutely overloaded. Essentially, you just want to chill out for a few days, and then you can gradually reload the tissue. Pain is your guide, so if it gets higher, it means you want to just chill out for a little bit longer. In that Achilles tendonitis state, you can bike, you can do elliptical, you can do other exercises. We just might want to let running hang out for about a week or so. Tendinosis is a little different. You want to target it, you want to load it, you want to actually go into some discomfort. to help decrease the pain, increase the load capacity of that tissue. Sometimes a little tricky if you're kind of a hybrid between the two. If you're a hybrid between the two, I would default to more tendonitis until that chills out and then you reload it. And so, yeah, through effective loading, you can help reduce the symptoms for sure. But again, I can't speak to how long it takes for the tissue changes to actually take place. And we have more about the Achilles tendon with kind of contributing factors of what leads to it and other ways to rehab it on our website as well.